hosting this alternative placements webinar today. So we're the Cheshire and Merseyside AHP faculty. My name is David Aspinall. I'm one of the project managers. On the call, we've got Charlotte Golson, who is the Cheshire and Merseyside AHP faculty lead, and we've got Graham Brannan, who's the faculty project coordinator as well, and he's going to be going through the slides with us today, and he's facilitating the presentation. So next slide, please. So just a little bit of housekeeping. So the session's being recorded and it'll be available on our YouTube channel. So there's the link to that. We've also got some Twitter handles there for you. So at Liverpool Live Uni Physio, at OT Liverpool as well. So we're going to be hearing today from educators from across Cheshire and Merseyside and the University of Liverpool, and how they've utilised alternative placement models in occupational therapy and physiotherapy. So please use those Twitter handles if you want to tweet anything and hashtag anything out there. So we've got the hashtag AHP faculty as well as we're hosting today. Please keep your microphones muted. I think there is possibly some background noise I can hear there. Just helps with interference with the presentation. Obviously, please feel free to leave cameras on because it looks like we've got an audience, which is nice. And there's going to be a Q&A session at the end, which will facilitate. So if you do have any questions throughout, please put them in the chat box. But we're going to try and get through the presentations uninterrupted, so the speakers can go ahead and deliver their presentations. But feel free to engage in the Q&A session afterwards. Next slide, please. I think I'll be handing over to Vicky now.
Thank you. So welcome to this alternative placements webinar, everybody. I'm Vicky Barnes-Brown. I'm the occupational therapy practice placement tutor at the University of Liverpool. And along with my colleagues, Amanda Deeves, physiotherapy placement tutor at the University of Liverpool, Rachel O'Brien, OT from Luft, Jackie Jeffs-Watts, physiotherapist from Luft, and Lorna Deans, OT at Merseyside. We're going to be sharing our experiences with you of alternative placement models that we've used in occupational therapy and physiotherapy students at the university. Next slide, please, Graham. So this is the overview of what we're planning to cover this afternoon. It'll include a discussion of various different placement models that we're currently using with our students, as well as student and educator feedback, and an opportunity for you to ask questions at the end. Next slide, please.
Do you know, I'm not sure.
So just a little bit of a background on placement models. So the model traditionally used within the health science programmes is one where learners are situated within the clinical environment on a full-time basis. But the COVID pandemic plus placement capacity issues has created the need for us to reconsider different placement models, and hence this idea of a blended practice placement where the learner spends half of their placement time in the clinical environment and the other half undertaking project work came about. We're also planning to discuss role emerging or non-traditional placements that are being used within occupational therapy and leadership placements that have been used within physiotherapy. There are several other alternative placement models that you may well have heard about that are currently being used across the country, such as virtual placements, research placements, and technology-enabled care services or TECS placements. However, this afternoon, we're only going to be focusing on the ones we're currently using with our students at the University of Liverpool. Next slide, please.
Thanks, Vicky. The utilisation of the blended practice-based learning placement was implemented as a result of several driving factors. Within recent years, there's been several policy documents that have clearly indicated that healthcare delivery is changing. The NHS plan and the People Plan support that healthcare provision should become closer to home. And this has led to an increased requirement of AHPs within the workforce, and nationally the number of students entering the profession has increased. Within the last 2 years, the shortage of placements has become in focus due to the pressures within the system as a result of the COVID-19 pandemic, which has led to cancellations of placements, educators shielding, and physical capacity issues within the workspaces. There's also been the work of the Clinical Expansion Programme from the Health Education England, which has supported a solution-focused approach. At Liverpool, with both the physiotherapy and occupational therapy programmes, these issues have required us to reflect, revise and reimagine placements quickly to ensure that all our students could continue with their placement experiences and progress on to graduation and be available to join the workforce without delay. Therefore, we had a large number of students using this blended placement approach to help solve the crisis that we were experiencing within the 2021 academic year. Next slide, please. As this approach had not been utilised on such a large scale previously, it did provide us with a unique opportunity to capture the views and experiences of multiple learners and clinical educators. We were able to secure ethical approval for this research, and LUFT was one of the main providers in this experience, so therefore it was essential that this model was formally evaluated. We adopted a mixed method approach, and this took place between March and July 2021. During this experience, we captured a variety of different physiotherapy and occupational therapy placements across all student year groups. The questionnaires were deployed post-placement, and we had a reasonable response rate. We also ran profession-specific focus groups to delve deeper into those learners' experiences. Next slide, please. A range of placement locations were utilised across both the primary and secondary health and social care sector, and these included both acute care settings and outpatient settings. The majority of trusts across Merseyside and Cheshire had some learners on these blended placements. LUFT did accommodate the majority of the students, but other learners were placed within CWP, St Helens and Knowlesy, Warrington and Holton, Wirral Community Health and Merseycare. The projects identified for the learners to complete included a wide range of activity. Most were centred around quality improvement frameworks, and these were identified by the teams that the learners were allocated to. These included the development of resources, audit activities, patient information leaflets, and updating other resources as examples.
Next slide, please, Graham. So we're going to play you some clips of student feedback representing what the students viewed as positive aspects of the placement, but also some of the challenges they found with this type of placement.
My name's Carl Patrick. I'm a second year physiotherapy student. So some of the benefits of doing this split placement was I was fortunate in that I was able to work closely with the band 8A, who was the lead in the department, Helen Kelso-Ashcroft. Positives of this were I was able to gain experience of devising, undertaking and presenting this project in a poster.
Hi, I'm Charmaine. I'm a second year physiotherapy student. Overall, it has been a rewarding experience, as I believe completing a clinical audit would be a CV boosting skills, which is required as a band 5 physiotherapist. And I have also completed a piece of work as an evidence to build onto my CPD profile.
Hello everyone, I'm Jackson. I'm a physiotherapy student from University of Liverpool. The good thing about the split placement is actually you will gain more information academically in terms of how the ward is functioning and what they are currently doing in their routines, which you can't learn this from textbooks or online videos, because we are focusing on topic that is based on the clinical side, which is very valuable and it's very unique for students.
Hi, my name's Laura. I'm a second year physio student and I took part in the blended learning placement on a So benefits that I found was I felt more refreshed going into the clinical days because it was less intense than what I would imagine a 4-day week would be.
Next slide, please, Graham.
The kind of challenge with this was the loss of exposure to clinical hours. So especially working within an acute setting, the cases are a lot more varied and therefore there's kind of less repetition. So if you are not there for those individual circumstances, then you're not likely going to have those opportunities again.
Some of the challenges that I've encountered would be the shortened amount of time that I was able to spend with patients, that I was able to see with patients, since I am just coming in 2 to 3 days per week.
Actually reduces students' time in doing practical hands-on stuff, which is the original idea of doing a placement, which is different from the first half of the whole physiotherapy program, which is academic. A project which is presented in presentation with some live audiences, while others are getting a split placement project only presented in a Word document.
However, I was quite unsettled by continually having to catch up with what was happening on the ward, such as the patient's discharges or changes in health conditions, which I would have missed. I struggled to build a rapport with the patients because I was seeing, my educators wanted me to see as many presentations of a stroke as possible and see the ways that I could have handled that, but I didn't really get a chance to practice that. Also, I didn't feel like I progressed as much, especially in my confidence with my clinical skills compared to other people who were on a full placement.
Next slide, please, Graham. Okay, so one of our current second year occupational therapy students had the opportunity to participate in a project-based placement for her first placement in second year, which is PP3. And it involved a presentation regarding the role and also the occupational therapy process in elective hip replacement. And she used NICE guidelines and Royal College of Occupational Therapists guidelines. And she also completed an audit project on total hip replacement clients regarding their length of stay. So she fed back that this was a very excellent experience where she learned a lot about the audit process and how to improve the quality of the service when collecting the data. It was an outstanding opportunity and she learned a lot in this placement and it has benefited her in many areas. Next slide, please, Graham.
The practice educators indicated that there were several benefits for themselves, the department and the students regarding this approach. During the social distancing issues, this helped to ease the pressure within the department and allow the new rules to be more easily implemented in the team. Some indicated that this pattern of attendance allowed them to meet their clinical demands more easily, and the team benefited from the service improvements that were completed. The educators felt that this allowed the students to show different skills in time management, organisation, and an understanding of non-clinical duties, as well as increase the learners' independent working skills. The educators felt that this allowed the students, the educators understood that this placement approach supported the development of these key skills that are required by Band 5 therapists. Next slide, please. The practice educators also expressed some of the challenges they experienced during this placement model. Some of these challenges mirrored what the learners had been telling us, such as the loss of clinical time away from the patients. And if this was an early placement for the students, it can take them longer to settle and become more comfortable with that environment because they've had less exposure to the routines within the hospital and those clinical experiences. The educators were quite conscious of the importance of the focus of the project, and when we really tried to consider how this added value to the team and the service and ultimately the patients. They also had some concerns regarding some of the individual motivations from the learners and their ability to be proactive. This insight provided us with a lot of areas to think about and really helped us to develop this particular placement model. Next slide, please. So we considered this feedback and the insights that we'd had from both the educators and the rich data that we gained from the focus groups. And really there were four main themes that we need to consider to ensure the success of this placement experience. Communication is essential. This is both to the learners regarding the expectation of the placement experience and to the educators regarding the framework and the structure and how this can be assessed within the various professions' assessment paperwork. This communication is a way in which we as the university can provide that support and guidance to both the learners and the educators. Ideally, this needs to happen in a timely manner. Whilst this model has been used close to the start of placements to help avoid a cancellation or a withdrawal of a placement, it's much better if we can plan this in advance to ensure that all parties are fully supported. The project needs to add value and meaning for both the educators and the students and the patients. This is where the service improvement framework comes in, and this really helps to monitor the success. And this activity is closely aligned with the development of Band 5 skills. Lastly, there are multiple factors that need to be balanced within this model. The requirement of the placement, the stage of the learner, the level of activity within the project, and the realistic expectations with agreed tangible outcomes. Often setting weekly goals can support the forward development of this independent work. I'll now pass over to Jackie, who will be discussing her experiences as an educator for this particular placement model. Jackie, we can't hear you.
There we go. Can you hear me now? Yeah, sorry. I'm just waiting for my slide. There's a title should be coming up. There we go. So I was just going to talk about my experiences of one of the physio students that I had. You actually saw him in one of your clips earlier on. Next slide, please. So I thought I'd give you a bit of background as to our setting. So I work at Aintree University Hospital. We are a busy general medical and surgical therapy service. We cover 14 wards across several specialities, as well as critical care, which is where I am based and where the student was based. We also offer respiratory support to other wards not routinely covered. We have an on-call service and a weekend working service. So as a team, we're very busy. Obviously, being an acute service, we've got lots of discharge planning to do, and those are becoming more and more complex and taking up a lot of our extra time. We did, at the time of having the placements, this student on this particular placement, we were going through obviously a bit of a sort of turmoil with staffing regarding sort of various reasons, so sort of reduced staffing levels, both in sort of senior areas as well. This might have been through just staff vacancies, sicknesses, isolation periods, adjustments of different people doing different roles, and some of our band 6, 7 team taking on more managerial and leadership tasks as well as your normal annual leave. So you've got all those kind of extra pressures to think about at the same time. Next slide, please. So the student was placed on critical care with myself. I work part-time. I only work 3 days normally anyway. And the actual placement was, the project was based on one of our medical wards, and it was set by our therapy manager. It was basically looking at the complexity of our patients, as mentioned just before, about them being very complex from a discharge point of view. And it was to assess on one particular ward using a screening tool. So this required several different skills to be used. So it required learning and implementation of a specific learning tool. data collection, data analysis, presentation of the findings, and then sort of thinking about areas for potential service improvement. So it sounds quite a lot, but he did get quite a bit of help to sort of start the project off. But there's lots of skills there that the student potentially pick up and sort of improve on throughout the placement. Next slide, please. So to implement our particular project, there was an initial meeting with the therapy manager to discuss what the project was going to entail, and then provide information to the student and other staff contacts that they could use to help them to carry out the project. Support was given for actually learning the screening tool, and time was given to set up the project from the therapy manager and the lead therapist that was working on that ward. They were given the full length of the placement to complete the project, so they had that full amount of time. Main time was given was a Thursday, because my day off was actually a Thursday, so it just timed in quite well. So that when I wasn't in, he was able to do some of the project work. The student then independently arranged further meetings with the therapy manager to discuss the project and how to develop it. Next slide, please. So this was actually the very good poster presentation that resulted from the projects that my students carried out. I won't go into it in lots of detail, but he basically produced this poster presentation at the end of his placement and presented it to our team. And I think it actually got put up in some of our board around the hospital. So it looked at a particular medical ward that was known to be quite complex. And the aim was to use an adaptive screening tool looking at things like the frailty, the medical conditions, and sort of adapting this screening tool to assess a certain number of patients on the ward. And then based on that, they kind of looked them into what kind of pathways they would normally go down. So pathway 0 was kind of straight discharge out, home, no extra needs or services or equipment needed. And then the pathway 3 was sort of patients that are now no longer to be discharged back to the home environment for whatever reason. So it was kind of put into different categories of pathways, and then that led us to kind of know how complex those patients were. So from the little projects that they did, they found that actually we didn't have enough staff on the ward and seniority on the ward to cope with the complexity of the patients, and that we were having to then move staff in from other wards to that particular ward to deal with the complexity. And it just meant that it gave us an insight as to maybe looking forwards where our skill mix is, and then obviously that tool could be used on other wards potentially to assess any other particular complex wards that we've got. So yeah, so there's the conclusions that we've got written down there. Deficit in therapist hours to meet the patient's needs on the wards, and then yeah, assess a patient's complexity on other wards, and better distribute our resources. But I just thought it was a really very well thought out, clear presentation, and lots of the team were quite pleased with the result. Next slide, please. So practicalities. So the university did give us as clinical educators a guide on how to mark the project in terms of the scoring. So obviously it's a slightly different way of looking at things. So obviously we've got the sort of normal scoring system that we would use to assess them clinically, and how we might use some of that scoring to then score them on their data analysis, on their presentation skills. So kind of using some of that system to kind of score them on their placement as a whole. The student did feedback to the clinical educator throughout the progress of the project, and also at the halfway assessment we went through and did a little bit of an assessment of how things were going with the project. I found it quite useful as being a part-time educator, that the days I wasn't having to sort of try and find where's the student going to go. They were able to kind of do this project work. So sometimes it's quite tricky to, especially if other areas are quite short, to sort of find out where your student might best benefit from going somewhere, rather than just putting them anywhere, somewhere they might actually benefit from some sort of gain some positive experience. And obviously through this project, it meant that he could do his project work in that time. It does rely on the student to be a very good communicator and to continuously update on the progress of the project. Really good time management skills to allow for mixing between the two placements, so your clinical and your sort of non-clinical project work as well. Next slide, please. Recommendations. So I would say to allow enough time prior to the student's arrival so that the clinical educators have time to create a meaningful project that's actually going to be of value to us, of value to the students. So we've got that time to sort of properly organise something. So that's a definite. Ensure the student and educator are aware of how the blended placement project will be used to enhance the students' learning and how this will contribute to their end of placement assessment. So maybe having a bit of a chat at the beginning about the project and how this is going to be, how this could be used to enhance their marks and what skills they might learn. So kind of having that conversation at the beginning between yourselves to sort of, so you both know what to expect. Ensure the project is achievable, and the main emphasis obviously on the placement should be on your clinical experience. And I know some of the students have already sort of said that they do, really want that clinical hands-on experience. So just making sure that the project doesn't really take over too much and they've got plenty of time. I know as well, I think my student was a third year student and they had dissertations to do as well. And I know sometimes they've got assignments. So if you've got a project that they're doing that's then suddenly eating into their home time because they've not got time to do it in their time at the hospital on placement, then obviously that's going to add extra stress for the student and it may sort of suffer for the sort of placement experience. And just to have regular meetings to update on the progress of the project, just so you kind of know if there's any issues along the way, you can kind of hone the project back in if it's getting too out of hand, or sort of give them a bit more support needed along the way if needed. Okay, next slide, please. I think that might be it. Yeah. And I think I'm going to hand over to Rachel.
Yeah, thank you, Jackie. So hiya, my name's Rachel. I'm one of the OTs in the prehabilitation service at Liverpool University Hospitals. And I had a student last year who had a split project based placement. So I'll just chat a little bit about that. Next slide, please. So just a bit of a background, similar to Jackie, about our service. So we're predominantly an outpatient-based service, and we cover of the sites in Liverpool University Hospitals. Our service aims to support patients in sort of optimisation of nutritional, physical and emotional wellbeing in preparation for cancer surgery or treatment. My role in the team, or the OT role in the team, is quite newly established. So I think I've only been with the team myself for about a year. So we've never really discussed having an option for a student in the team, but we felt like it was something that we would be able to support, offering a placement. We didn't really know how it would work, just with it just being myself and the team as the OT, but we sort of chatted between ourselves. We work very closely together as AHPs, so felt like it would be something that we would be able to offer if we offered it in this split placed model project type of placement, to be able to support sort of what suited us best. Next slide, please. So what the placement involved, so we did a bit of pre-planning, so we reviewed sort of what projects that we would potentially ask the student to complete for us. So in that, we obviously considered what would be achievable in the time frame. It was a 6-week placement, so what would obviously the student be able to get out of it, but what would we be able to benefit from it as well as a service. And together we sort of came up with a list of things that we needed. So it included things like ideas for audit, research, resources for staff, resources for patients, and we put that together. We reviewed sort of what the students' timetable would look like. So the students spent, it was about 2.5 days in clinic, 1 week and 3 days the next week, combined with obviously their allocated time that they're allowed for their uni study as well. And just in preparation, we just made sure that the student was aware of what type of model of placement that they were going to be doing, so that they were able to include that in their induction time as well. And then we obviously reviewed the projects with the students, so that they could sort of have a look at them and see what they felt they would be able to achieve, what they were interested in, and they were able to choose in collaboration with us as well. Next slide, please. So what went well? So we had really good collaborative working between ourselves. So us as a team, thinking together as AHPs how we could support an OT student, but also ourselves and the students being able to come up with the ideas and the projects that she was going to work on. And the ways that we were going to help support her, ensure that she was achieving her goals. We decided to have the supervisions that we had. We discussed the project within them to make sure that she was on track, and that she was achieving what she felt like she wanted to by the end of the project. It made managing my clinical and non-clinical time much easier. So obviously as a band 7, there's a portion of my time that you've got to spend on non-clinical duties, and actually having the students around and having her work on some things that I had no time to look into was much easier. The end of the placement, we had an additional resource that she'd done for us. So she did a case study of a patient that she followed from initial assessment all the way through their pre-surgery journey, really, which was really helpful to be able to have feedback on that patient and their experiences. And she also did a resource presentation of sort of a mental health and well-being that we could deliver to patients. So that obviously included anxiety management, coping strategies, which is really useful to be able to go through with patients as well. So we had that resource at the end of the placement. And we got good feedback from her as well. So obviously she really enjoyed it, and she enjoyed the split as well, being able to do some work from home on those projects as well. Next slide, please. So what didn't go as well? So it did take a little bit of extra time to plan. There was a bit more sort of sit down and thinking about how it would be, rather than being able to have the student with you sort of in clinic all the time. Although we did get positive feedback from her, they did feel, because it was a 6-week placement, by finished, it was a bit, I think she would have liked to have done a little bit more face-to-face clinical with patients, and I think that was just because she enjoyed, that time that she did spend in clinic as well. And I had to think a little bit more around, when it came to the final assessment, how sort of her project-based side of the placement translated to the final assessment, and sort of scoring and things like that. Next slide, please. Yeah, so just in conclusion then, for our speciality setting, the split project placement worked really well. We're continuing to use it moving forward. So I've got a student with me at the moment who's following the same model, just because it lends itself quite nicely for our setting, really. We got something out of it, as well as the students, which I think has been really helpful for us as a service. The only thing that I wasn't quite sure about, but obviously Jackie's spoken a little bit more around this, is how it's translatable into an acute setting. So there was just more questions and more that I had around that, because obviously having the experience in the outpatient setting was a little bit a little bit more straightforward. I had a bit more time to plan what projects we needed and what projects the student could do. Yeah, lovely. So that's our experience. I think I'm handing over to Lorna.
Hello. So this was my project-based placement. So could I have the next slide, please? So what happened? So I work in an older adults mental health team, community mental health team, in South Sefton. And the team only has me, one occupational therapist, and I work Monday to Friday, 9 to 5. And the team is still very much working under COVID-19 restrictions. So a lot of our meetings are remote. Staff are encouraged to work from home from possible. And at the point that the student came along, I'd actually already just had a student on placement, and the student who came was actually somebody who I think needed a placement at the last minute. And I tend to feel quite sorry for them, and feel that this person wanted a placement in older adults mental health, and so I volunteered. And the PEF Jackie suggested that perhaps we could do it as a project-based placement. So we met with Vicky at the university, and we discussed how that actually work. And the student spent approximately 2.5 days face to face and 2.5 days on the project. And at the end of her placement, she presented what she'd been working on to the team and produced a set of resources for the team to access. Now, the subject that she covered was the use of technology with people with dementia. And so it was a really broad topic, and the reason one of the reasons we chose it was because it isn't just the OTs who are recommending to families and service users technology to promote leisure, manage risk, safety, whatever. It's often the nurses in the memory clinics, and I'd felt that perhaps we could all do with a bit of an update and considerations of what technology was out there. Could I have the next slide, please? So at first, I was concerned we wouldn't find a suitable project, but the discussion with the university helped with this. And like other people, I was concerned that the student wouldn't get enough face-to-face experience with a complex client group and meeting the objectives. But I was relieved that the student would have some structure to the time when not with myself or with another team member. I did work part-time for a very long time, and I'd always had students, so I had always relied on the students to occupy their time purposefully when they weren't with me. So that wasn't something that was new to me, but I did feel that the project actually put a lot more structure to that. It gave a lot more focus. And so it was formalising an approach I had previously taken in quite a much more structured way and a much more focused way. Could I have the next slide, please? So overall, it was a good experience. It helped the student focus in depth on one area of intervention. We could link the placement objectives to it, and there was a clear evidence of achievement. It wasn't relying on having a chat in the car on the way back from visiting a patient at home. The student could work independently both at home and in the office, leaving me free to get on with other tasks. And it did give the student a deeper understanding of the area of practice, for example, considering the ethical implications of recommending technology. And that technology was a bit more than, it's just a bit more than a falls monitor, that think about how we use everyday technology with the person with dementia, which and also the barriers to using technology for a person with dementia. The project focus built on their previous understanding of OT interventions. So when the student came to me, she'd never actually had any experience of a mental health placement. And she'd done a lot of placements that seemed to be related to equipment provision. But so for her, looking at a different form of equipment in terms of technology actually worked quite well. I would definitely do it again. What I would say was, I think I would be a bit more boundaried about, this is the time you're spending on the project, this is the time you're spending with me. I think with the reduction in the restrictions due to COVID, a project where any student would be able to go out and use them as the focus of visits to other services would be great. That this student actually did make phone calls to services that provide technology in order to gather information. And I think I'd try to make sure that whatever project was chosen in the future had a similar opportunities, that it wasn't a literature review, that it was as different as possible from perhaps some of the more formal academic work, that it was very much linked to giving opportunities to perhaps visit other services, see things in action, liaise with other people. And I have to say, at the end of the placement, my colleagues were also impressed by the presentation, and we've gone. Hopefully, it helped everybody's skills develop. Could I have the next slide, please? Yeah, so the conclusion of future planning, it freed up time, it gave the student autonomy, but did wonder whether it might be a challenge to keep on finding new and interesting projects. But the project that the student did could be developed further. It would be, in a way, it would be interesting for somebody else to build on what was started. Unfortunately, there was a bit of a communication breakdown, and that because it was at sort of short notice, a student didn't actually know that it was going to be a project-based placement. So obviously, I would make sure they knew well in advance next time. And as I said before, I'd make clear what time is for the project and what's for client-focused activity. And I would say that support from the university was invaluable. I could have the next slide, please. So my student was actually asked before she finished the placement, would she provide some feedback for a presentation in another group that she was quite happy with. So this was her SWOT analysis. So she felt that the project meant that she always had something to do. It promoted independent learning. It was a nice change. It meant she could be flexible. It meant she didn't have to travel from the other side of Liverpool, so she felt that she was fresher. It fitted in well with the pandemic restrictions. It provided a lot of evidence for a CPD portfolio, and it provided evidence of presenting skills. The weaknesses, she felt that it might be difficult to find another project that was interesting. It could potentially feel quite overwhelming if you felt you had a big project and a busy time on placement. I think, like other students, she felt that maybe that it could take away from face-to-face opportunities, that it could feel a little bit too familiar to academic work in universities. And I think she said she felt it difficult to know when to switch off, which I hope meant that she found the project interesting. She also felt that, and then she did say to me that the threats and weaknesses that she identified wasn't necessarily how she felt about her experience. It was potential threats and potential weaknesses. That if you didn't get enough support, then you might not complete your project, that it might impact on your outcome of placement outcomes, reduce the amount of practical experience. There might not be time in some settings to meet with the team and present, and that she felt that a short placement, it would be very difficult to balance a project and practice. But opportunities, she felt that it was able to demonstrate skills that weren't necessarily easily demonstrated on the placement. For example, applying theory, presentation skills, managing time and workload. And it was an opportunity to gather more knowledge and evidence for future practice in CPD. And it was a great opportunity for providing service training for the team on placement, helping the team understand the role of occupational therapy as well as the intervention that she researched. And it also supported the skills she needed for her university course, for example, evidence searching and essay writing. So overall, it was a positive experience. So thank you very much for listening, and it's back to Vicky.
Thanks, Lorna. Okay, so we're going to move on to role emerging placements, which are sometimes called contemporary or non-traditional placements. I'm going to talk about it mainly from an occupational therapy perspective and what we're doing at the University of Liverpool. However, these types of placements are being used across other professions now. But in occupational therapy, it's a model that's been used for a number of years. So quite a lot of you, in the audience today, might have had one of these types of experience if you trained at a different university. So a role emerging or a non-traditional placement is one in which the learner is placed in a setting where there is no qualified occupational therapist working there. So for example, we could place a student in a setting such as age concern or another charity or private or voluntary setting. The learner would then have long arm supervision, so they'd be supervised on a day-to-day basis by the charity or the organisation, someone working there, and then they'd have long arm supervision, which is once a week with a qualified occupational therapist, and that's to ensure that they're applying occupational therapy skills within that setting. They've got a clear learning contract and that they're actually on target to achieve the learning outcomes for the placement. So as I mentioned, this is a model that's been used for a large number of years in lots of occupational therapy programmes, but it's not something that we've used at Liverpool. We've never made it a mandatory component of our BSc undergraduate programme, but it is something that now that we've got a pre-registration master's programme, we are making it one of the placements within the master's programme. Okay, next slide, please, Graham. So this is just a bit of a structure around what we're going to do in the master's programme. So in year 2 of the master's programme, it's the third placement, so PP3, that the students will be doing, and it's 6 weeks long. So what we're planning on doing is sending 2 students to go to 1 placement setting, and their role is to apply an occupational lens within that service and promote the role of occupational therapy. They'll also be involved in, they'll have self-directed learning or study time like all of our traditional placements. So at the moment within the university, we're currently setting up these placements. We're working with different organisations that could accommodate our students within these settings. So what we'll be looking for from educators is long arm supervisors to provide weekly supervision and assessment of the students in the practice setting. Okay, next slide, please.
Thank you, Vicky. Within the School of Health Sciences, we've developed and successfully run leadership placements for 4 learners as their elective placement experience. This was an ideal opportunity to enhance the leadership skills within these particular individuals. And as you know, leadership is a requirement at all levels within an organisation, and it's embedded within the 4 pillars framework of professional practice. These 4 pillars outline and provide the structure to the learning opportunities and development of the workforce. Clinically, this is the pillar we're potentially more familiar with, and it's certainly the activities that the students seem to value the most. And it incorporates the knowledge and skills and behaviours to provide high quality self-health care that is patient-centred. Education involves the teaching and education and empowering of others, and that includes facilitating students' learning, supporting learning activities, and learning from supervision. For our learners, this is the ability to teach their patients and empower their patients. The research pillar is related to using evidence to inform our practice, and this can be formal research, service improvement, considerations of guidelines into practice, measuring outcomes and testing change. And for our learners, one of the main activities might be including that consideration of evidence-based practice and the robust use of outcome measures. The leadership pillar identifies as one of the essential requirements for delivering high quality services, and leadership does apply to all. It's a skill, not a role, so an early exposure can really influence and help develop these skills and allows the learners to recognise these attributes and start to build these particular expertise. These particular skills will help to develop the flexibility and sustainability within the workforce to meet the current and the future population needs. So whilst this placement was non-patient facing, we felt that as an organisation we were well positioned to provide a placement to develop these skills and provide a focused experience for the learners. Next slide, please. So we followed this structure for the placements. We had 4 learners, 3 were from year 3 and 1 was a second year student. The placement was 3 weeks in length as it was an elective. However, on reflection, we think that 4 weeks might be more appropriate time frame to allow the development of their projects and skills within this particular activity. The placement was predominantly online and incorporated a variety of activities and utilised the support from the senior leadership team. The students could identify a project that they were interested in and they worked in pairs on this activity. They had clear activities that were identified as part of their self-directed learning. We also ran some simulated days, which was once a week, and these simulated activities had focused a leadership theme embedded within them. Next slide, please. So to enhance the student experience, we provided this structure to their weeks and to the process of the placement. So we developed a welcome pack and induction resources, and this provided them an outline of the key figures within the school, provided key contacts, and also outlined some project ideas and provided the context for the placement. Each learner was allocated a mentor from the senior leadership team, and this provided individual coaching and mentorship to that student. And within those conversations, the learners were able to identify their own needs, be directed to self-directed learning activities, and negotiated their learning outcomes. The projects were also supervised by a staff member interested in their particular chosen area. So one pair of students developed some simulation resources and the other pair produced an open day resources for the admission teams utilising the student voice. A structured timetable was provided, and this was to help them with the online working aspect. So they knew when there'd be the regular check-ins. We ensured the students had that close contact, so they weren't spending too much time working alone. And they also had that opportunity to come together and to bounce ideas off each other and to provide that peer support. We also had some self-development activities, and self-directed learning and reflection was encouraged and supported. So whilst we did provide a timetable, the students were able to negotiate their own time and contact as required. So the evaluation post-placement was very positive from both the learners and the university team, and this is a placement area we'd like to continue to use and further to develop and hopefully become a more regular opportunity within the school. Next slide, please.
Okay, so we've given you a bit of a whistle-stop tour or introduced you to a range of alternative placement models that we're currently using at the University of Liverpool. So what next? So certainly as a placement project team, we're looking at ways to manage our learners' expectations of different placement models and the skills and abilities that they can gain from them, because they are going to be looking at non-traditional skills that they're gaining, but they're all skills that they need for the workplace or entering the workplace. We're also trying to raise learner and educator awareness of the range of different placement models that are available to manage placement capacity issues. So for example, the blended placements that we've been talking about can be offered to prevent placement being cancelled and to also ensure that our learners have continued access to clinical education. And then moving forward, we're looking to seek out future partners to develop further opportunities for our students. So we're considering the use of research placements and also leadership placements within clinical sites. We've just run one of these recently within the last few months in occupational therapy at Warrington and Halton Trust. So again, we'll be reviewing how that went, but again, we're looking to expand those things as well. And then we want to continue to gain both our learners' feedback and yourselves as educators' perspectives on these different models as we're going forward. And then one of the things that's come from obviously the learner feedback and the educator feedback, because we put these placements in place quite rapidly in response to, you know, the pandemic, is the need for communication that Amanda mentioned before, and maybe developing further handbooks and guidance resources for educators and learners on the different types of placement models that we've been using. Okay, next slide, please. Okay, so we've put up a range of further resources that are available for yourselves as educators. I know in occupational therapy as well, we have a placement Padlet that we provide to our educators that has links to these resources for you. And then hopefully most of you will have seen recently that the Cheshire and Merseyside AHP faculty have now got their own webpage. So again, I know Charlotte mentioned earlier that they were going to put that as a link on when we send out the slides for this presentation, because that has a wealth of resources available for you as well as educators to support you in your roles. Okay, next slide, please. Okay, so just some of the references we've used, and then finally, next slide. Well, thank you all for listening and attending this afternoon, and I'm sure all of us are available if you've got any questions for us.
Thanks, Vicky, and thanks to all of our educators and Amanda as well for presenting on today's session. It's really great to hear about the different types of alternative placement models that are going on across Cheshire and Merseyside. Does anyone have any questions for our educators or for Amanda or Vicky? Nisha?
Amanda, mic down. Hi, Vicky and Amanda. Thank you for that, and all the educators as well. It was really inspiring. My question was around whether these models will be used only as contingencies, as in, you know, when there is a cancellation on the horizon or when there is a difficulty, or is there any plans to actually, from the university, say that we want to have, you know, one hybrid placement. We want to have a project-based placement, because that will give a real motivation for providers then to provide those as well. And I guess my second question quickly was around the educator training that we get from the university. Do those now talk about these models and what to do, you know, to facilitate them? So thank you.
Shall I go first, Vicky? So thank you, Nisha. Yes, you're quite right. We do need to make sure that these are embedded within our placement provision, and that's definitely where we're wanting to head. We recently have been working with one of the local trusts, with the view of this being a little bit more of the blended approach being a little bit more of a long-term solution to them, because it suits some of their part-time staff members. So they've piloted it recently, and with the view, like I said, to take this forward. So that's very much what we're doing at the moment, is trying to increase that capacity along that sort of part-time workforce place. And you're absolutely right, it is embedded within both our educator training and our student awareness stuff. And I think that's very important, that our students know that while, yes, some placements will be with an educator, with a team of students, and they'll be predominantly clinically, there are other placements where they'll be having this blended approach as well and doing different activities, whether that's project-based, leadership-based or research-based. So we're trying very much to raise awareness across everybody with the options of all these placements being available.
And certainly from an OT's perspective as well, Nisha, that the alternative placement models, are included in our educator training, our refresher training, and they're also on our OT educator Padlet as well. So there's information about them there. And, you know, like Amanda said, you know, initially we implemented this as a needs must, because placements were being cancelled, you know, to obviously due to staff deployment, due to social distancing measures, staff sickness. So it was, you know, a model that we sort of put in place to manage that and our placement capacity issues. But I think going forward, now that we've found out they do work and it allows flexibility for staff, then I think it's something, that we need to maintain.
Thank you. Next, we've got Andrew Lloyd.
I think you're on mute, Andrew.
Andrew, do you want to put it in the chat and I'll come back to you? Jenny, do you want to come in?
Yeah, hi. I wanted to just ask about the non-standard placements, the second part of that presentation. So the first one, obviously, the first half, we had some student feedback about that, and I wondered if there were any case study examples that perhaps could be shared to sort of show that model a bit further. And also, you were speaking about those students doing those placements kind of virtually, but I wondered whether there was going to be any scope for those students to be present on site in some of those standard settings in the future.
So the role emerging ones.
Yeah, the role emerging.
So the role emerging
yeah.
ones, they wouldn't be done virtually. They would the
Oh,
emphasis would be
okay.
they would be done face to face on site within those settings. But the long arm supervision that'd be once a week from an educator could be conducted via Teams or Zoom, or could be conducted face to face, depending on the educators and students' availability. But no, the plan would be that obviously they would be face to face within those settings.
Okay, and in terms of the educators for those placements, do you have lists of who they would be, or are you looking for people? How is that working?
Yes, we're looking for people now. So again, certainly on our educator and training and refresher training, it's something that we're mentioning. But yeah, certainly long arm supervisors, we'd be looking to develop a bank of those.
Okay, thank you.
On mute, Charlotte.
Sorry. Next, we've got Alison Leake.
Hi, everybody. Just to say that where I work in adult community rehabilitation services up in West Lancashire, we've spent the last several months since last summer exploring using virtual study days for undergraduate students. So they are gathering pace and seem to be quite well received. Obviously, we're depending on who's on placement at any one time. We have a mix of AHP and nursing students that attend the placements, but I work in falls prevention, and my team have presented once and are due to present again at the end of this month on aspects of clinical role of therapists in falls prevention. So just another way of delivering, really, because our teams are really tiny capacity wise. So we're just trying to explore different ways of offering some clinical learning to students in addition to the patient facing stuff. And it allows obviously the students to log into the call from home, so they don't have to be on site to do it. But equally, if capacity allows in our base over the next 12 months or so, we may well explore doing something locally in terms of having a group of students in with maybe one or two educators to do some more practical based sessions, perhaps. We're just definitely trying to explore this option of blended learning.
Brilliant. So it sounds like a really good example there, Alison.
Thanks.
Okay, we've got Andrew's question in the chat box now, which is to Vicky. So who were the clinical supervisors in the role emerging placements and not the daily educators?
So they would be from the actual charity, private, independent or voluntary organisation. So usually it's one of the people who work there. So say, for example, it was in a supported living setting, then it could be one of the nurses. So it could be another health professional that could be the day-to-day supervisor. We've had a role emerging placement in the past in a school setting, and it was actually the head teacher who was the day-to-day supervisor, and then the occupational therapist came in, which was me at the time, and did the long arm supervision once a week. So that's how it's worked in the past. So we have one person who's the main contact who works in the organisation to provide day-to-day support to the student, but obviously they're not from an occupational therapy background.
Thanks, Vicky. And then Andrew's also asked whether there are any plans to do physio role emerging placements, but Amanda said there's not currently plans at the moment.
No, I'm very keen to increase the amount of sort of blended leadership, clinical and research placements, whether that's a full research placement or a blended research and clinical placement. So that's really the direction that I'd like to take physio placement expansion into. So again, if there's anybody in the audience that feels that there'd be a good contact for either of those, I'd be very grateful if they reached out to us.
Thanks, Amanda. Dave, do you want to come in with a question?
Yeah, I just wanted to ask that for those planning on using project-based placements, do the HEIs provide the students with a project, or is it the trusts and organisations themselves that come up with the project ideas, or are the students encouraged to come up with project ideas?
It's been a bit of a mix so far. So certainly what I've tried to do is, if somebody is mentioning they're thinking about a project, is to try and meet with the educator first about what sort of ideas they've got, you know, what are the service improvement issues within the service currently, and what could the student realistically do. Because one of the things we were quite keen to look at is making sure that the project was big enough for the length of the placement, for half of the length of the placement, but also, like Lorna mentioned before, that it wasn't too big and, you know, potentially overwhelming for the student. But one of the main things we wanted to focus on as well was making sure that the project was valuable for the students' learning, to get those, you know, non-clinical skills, but different, you know, digital literacy skills, adaptability, flexibility skills that are needed for clinical practice. I've lost my train of thought completely now, to get those sort of skills, but also that the service was valuable, the service project was valuable to the service and also patient care. So I don't know, Amanda, whether you want to chip in, because I think we've worked a bit differently originally, haven't we?
Yeah, I think to try and, as we were alluding to within all the presentations and the feedback from the educators that presented too, I think getting the value of the project is one of the trickiest things. And if that can come from the trust, so that the supervisors and the educators and the physios or OTs that are involved with the patients within that project are fully sort of on board and embedded with the idea, and the students know that their work is going to be used or influence further practice, then I think that really adds to the benefit from the learner's perspective, in that work is valued and it is useful. So from my perspective, I have supported educators in the development of those ideas, but the initial idea has really come from them and about their service. And then, as Vicky said, the discussion with them on the tangible outcome the student will produce, but also the volume of work and the requirement within steps to get to that end point as well, to try and get that balance right within it. So ideally, the initial idea is best from the placement, and then we can provide that support and guidance to hopefully get to everything at the right level to meet everybody's needs.
Yeah, something we do as part of a diet. Well, I've got a dietitian's hat on, but yeah, something we do in dietetics is we have an ongoing list of potential kind of audits or projects and things like that we could potentially get team members involved in, but also students as well. So probably encourage trusts and organisations to do something similar. But yeah, that works well for us.
Samstar?
Hi, yeah, sorry, it's not really a question, it's more just to introduce myself, because I know I've worked quite closely with yourself, Charlotte and David, and Vicky, I know I'm booked in to meet with you tomorrow. Yeah, just introduce myself. I'm Sam, I'm an OT by background at Luft, but I've got the CPEP project management secondment, so I am working with placement expansion. So I'm focusing on more OT and dietetics. So this presentation was really useful just to really broaden, because it's very easy for me to kind of stick to the same sort of models, but this really opens it out and really goes more in depth. So yeah, it's just more to say thank you for that, and yeah, and look forward to working more with you all.
Thanks, Sam. We've got another question from Andrew in the chat, which says, you mentioned that you're looking to create a bank of long arm supervisors. Will they be from trusts in their normal daily work, paid or retirees? As long arm placements expand, finding the long arm educators will be an issue.
So this is, I did post initially that it would be a good role for part-time staff, and then I know Nisha's just added around will the placement provider get the tariff. So this is something that we're looking into at the moment, because that's going to be a potential barrier for us. So if it's the placement provider that only gets the tariff and the long arm supervisor doesn't get anything, then that would be a barrier for long arm supervisors coming forward or sustaining those individuals. So again, we're just looking into that at the moment and how that all works.
Thanks, Vicky. Jean-Claire?
Yeah, I was just going back to the idea of that Dave was talking about having a list of audits and things. I'm wondering if it's something that we could put into the digital toolkit as a repository where people could go to think, for ideas, because I know other people have done some work around EDI and the sort of profile of the staff and looking at ethnicity of staff and barriers to supporting BAME members of staff into AHP's career. So it's not just clinical stuff that we need, we could have it on as ideas, is it? It's something around that leadership part, that service development and workforce planning.
Yeah, I agree, Jean. I think we've already got a leadership tool within the toolkit, haven't we? So that's something that we could add in for the resources. In that toolkit as well, we've also got some examples of some our YouTube videos of where we've had students on leadership placements within the faculty that are another examples that could be used to have a look at. I've just got a question for our educators speakers today, and that was that you all had one student at a time on a placement. I wondered whether you thought it'd be more beneficial to have more than one at a time, or whether you felt like the students coped okay being by themselves.
It's Lorna. I think my student was fine being on her own. There wasn't really an issue. I can see that you could potentially have two students and swap them over, but so you could have a student doing face-to-face and a student working from home and then swap over for the rest of the week. But then that would depend on the educator being able to, again, it's that time when you just need to get your head down and fill forms in or have your own supervision, that sort of stuff. But it would be possible, particularly if you were working in a setting where you weren't the only therapist, or you've got other. I mean, my nursing colleagues have always been very supportive, but obviously they've always had their own students as well. But we all support each other with our students, and if you're in a setting like that, then I don't think there's any reason for the student to feel that they need another therapy student with them.
Thank you. Jackie, did you want to come in?
Yeah, I was just going to say, I guess it does probably depend on the actual sort of where the placement's based. It might be easier in certain situations. I know for myself, working in quite a busy acute area that's kind of quite changeable. Yes, you've got more staff available, but it's still, I think I'd prefer to just have the one student for that kind of blended experience, just to kind of to make sure that you've got enough time to focus on that student. And I think for myself, I think I find it quite difficult to have two in quite a busy environment. But yeah.
Thank you. Next we've got Alison.
Hi, just a point of information again rather than a question. Certainly on rare occasions in the past in community rehab in West Lancs, when we've had OT and physio students out in community at the same time, if a particular project or something we were going to deliver to the public was suitable for students to work on and take a lead on, we've actually had physio and OT students working on something together. So I think the more, I think also, and I know one of my OT leads is on this call today, that if opportunity presents itself, that we can kind of dovetail the placements for physios and OTs, and where possible they can be working on something together, because certainly on the rare occasions that it's happened, we had it's years ago now, but we had a physio and OT student on at the same time, and we were doing quite a lot of events around falls prevention for the public, where we would attend health fairs and things. So the two third years that we had at the time, rather than us do it, the students led on it and did the whole thing themselves, and we just dropped in during the course of the day to see if they were okay, and they loved it. So that, you know, the opportunity to do more things like that, because physios and OTs work so closely together. No disrespect to the other disciplines, but I just think there's an ideal opportunity there if students of a number of disciplines are on at the same time. That maybe more collaborative project working could be achieved. That's it.
We're in agreement with that one.
Yeah, good point.
We've just got another question in the chat, and that is, does the student get a choice of whether they would like a project-based placement or a traditional face-to-face placement? And then another question, do all students have the same amount of clinical placement hours over the whole course, regardless of the type of placement?
Yes, I mean, regarding the hours, this is one of the beauty of doing this hybrid or blended approach, is that the hours that they're doing on meaningful activities can be credited for placement hours, because it's embedded within that placement work. So over the course of the training period, the students will all achieve the required number of hours. We don't give our students a choice over whether they want to do this type of placement or they don't, because whilst we're looking to have placements more regularly and more known in the planning aspects of this will be a hybrid placement or a blended placement, with the experiences that we've been involved with more is to make sure that the placement hasn't been withdrawn, to problem solve and to ensure that the placements have gone ahead. So the student hasn't had the choice on whether to do the placement or not. This has been a solution to allow the placement to continue predominantly. But as I said, we are working with our partners now to work more around the planning and to see what areas can be opened up by these particular models.
I think the other thing is that what we tend to do at the university is track the students who've had a placement like this, because we don't, you know, ultimately we still want students to have the clinical experience too. So if a student's done a project-based placement, then they wouldn't necessarily get another one within the programme. So that's something that we're sort of, you know, tracking the types of projects they're doing, but also tracking which students have done these types of placements, so it's, you know, equitable. And yet all students have got to, OT and physio have got to achieve the minimum of 1,000 hours across the 3 years of the programme.
Do we have any other further questions today for our speakers? Jackie and Sam, I'm presuming yours are old hands that are still up.
Yeah, sorry, I didn't mean to take mine off, sorry.
No worries. No final questions? We'll close today's session then. So thank you to all of our speakers. It was great hearing about your experience and hearing the student experiences today. We will, we've recorded this session today, so we'll send out the link to everyone who's attended. So you'll be able to forward that on if you want to. And then you've got the resources that Vicky's put in her slides there as well. Thank you all.